Welcome to another episode of Foresight TV. We are broadcasting through LinkedIn, through YouTube, and through the Senior Living Leadership Group on Facebook. I am so excited about my guests today. I have got Bob Kramer, the founder and advisor to Nick. I've got Kelsey Mellard with Sitka, who is it's a telemedicine, specialty telemedicine company. But where I'm actually going to start with my friend Richard Nix with Yardi. Richard, thank you for joining us. I want to just acknowledge the folks who support Senior Living Foresight, because without their financial support and what they do to make the industry better, this broadcast like this would not be possible. I apologize that we've got a little bit of a echo today. I don't know what that's about. I'm going to have to work on that. But Richard, thank you so much for being a part of this and supporting this. What I'd like to start with is how are you at Yardi really working to support senior living communities as the world has turned so upside down with COVID?
Yeah, thanks, Steve. Glad to be here. We really, actually, Yardi is a data-driven company. So as you know, a lot of clients now and the operators want to know more what's going on with COVID and checking. And one of our recent products is a business intelligence tool that sits on top of all of Yardi that's called Senior IQ and allows them to see in dashboard form really this data. And what's nice is, and Bob will love this, is we have an arrangement with Nick where they can benchmark, operators can benchmark their communities against folks in the NIC-MAP data space, also against their budget and against other communities. So that insight really helps them manage their operations much better. And then in turn, that technology allows them the time to spend with residents. And that's the end of the, the real name of the game there.
Yeah, I really like that so much. And by coincidence, I've been talking to, just in the last week, I talked to two significant operators who are using your dashboard and have talked about how valuable it is in this time of COVID to figure out how to operate their communities at an optimal level. So I think this data thing is really terrific. We'll actually drop a link into the comments so that you can find Yardi and Richard after the video broadcast is over. And I thank you for that very much. I'm going to go ahead and bring Bob and Kelsey on now. And once they're on, I'm going to do a little introduction, and then we're going to actually exit, and they are going to talk to us about their vision for senior living in the future.
Great.
So Bob, Kelsey, you guys, Bob, you in particular are so well known. I think I've probably done all the introduction I need to do. I'm going to let you introduce Kelsey. I'll be in the background, but I'm going to turn it over to you, and Richard and I are going to exit. So thank you very much for being here.
Great. Well, thanks so much, Steve, Senior Living Foresight TV, at Richard and Yardi. We really appreciate the work that Yardi is doing to work with and support providers during this time, and the opportunity for Nick and Yardi to partner in some things has been terrific. I'm excited about our half hour together now. And again, I'm Bob Kramer. I'm co-founder and now strategic advisor at NIC, and also founder and president of Nexus Insights. And joining me today is Kelsey Mellard. Kelsey is CEO of Sitka. But I'm going to, Kelsey, let you tell us a little bit about yourself, but I'm going to set it up a bit. You know me well enough to know I often like to do that. But Kelsey, you have a long and distinguished background in healthcare policy and practice. Now you're engaged and have really put some focus in the senior living space. So give us a little bit of your background by way of answering my question, which would be, what caused you to suddenly get engaged with seniors housing and care with a background more in healthcare, both policy and practice? So help us understand that journey and tell us a little bit about yourself.
Yeah, thanks, Bob, and thanks, Steve, and for hosting us this afternoon at Foresight TV. Yeah, I'm Kelsey Mellard, and my journey really into the senior care space actually started when I was at Kaiser Family Foundation, crunching data on state health facts, looking at Medicare utilization across the senior population. After a journey finding my way inside the federal government, where I was fortunate enough to be on the startup team at the Center for Medicare and Medicaid Innovation as a result of the passage of the Affordable Care Act, really spent a lot more time thinking about how are we transitioning our seniors, not only from a financial perspective to think about the Medicare Trust Fund and making sure that that maintains some sort of solid foundation, but obviously as we think about payment models, and those payment models is really where the rubber met the road for the senior housing care communities. And my time at Navi Health really helped me focus on thinking about these transitions of care and where these seniors were going after hospitalization. That put me very squarely in the mucky space of policy, payment, and transitions. And then from there, started to work with Nick actually on the Spring Forum, and have been really enjoying my time on that committee, advising the Spring Forum, and then went to Honor. And Honor is now a 6-year-old company based here in the San Francisco Bay Area, focused on home care. So again, the passion as I've started to kind of see these worlds converge of now care communities, senior care communities are now becoming healthcare communities. And I think that's absolutely the wave of the future. And especially as we see financial models begin to shift and converge, that's really my experience into Nick and the incredible family there, and then more broadly the senior housing communities.
Thanks. Well, as you alluded to, you served on the NIC Spring Conference Planning Committee for several years, and most recently, you were a panelist on a session you helped put together on telehealth and seniors housing. And again, this may seem like years ago, but in the first week of March 2020, the NIC Spring Conference took place in San Diego. The last week we could have held such an event before the pandemic really struck, and such conferences and travel were out of the question. But at this panel, where you were together with Robin Glass, the president at Doctor on Demand, and it was a terrific discussion. I was there. I was in the audience, but there weren't many of us in the audience. To say that it was not top of mind, clearly, to providers and investors in senior living the first week of March 2020 would, I think, be an accurate, if not just an understatement. And we were all talking then about, we know this is coming, but other than early adopters, there still wasn't a whole lot of interest. There were many other things more top of mind for most senior living providers and their investors. That changed. And we know in this one sense, what changed was COVID. But tell us a little bit about, how did we go from early March with absolutely, particularly in the senior living space, a sense that was a way out there future thing, but for most providers, it just wasn't something they were even thinking about dealing with anytime soon, to the just incredible overnight transformation in terms of interest and applicability of telehealth into the senior housing and care space. Give us a little bit of a sense of what happened since that first week of March.
Yeah, I mean, so much in the world has changed, right? And when we think about specifically telehealth utilization and increasing access, and of course, adhering to pretty strict precautions, right, of how we're exposing one another to this pandemic, it's become a crucial point of conversation. I want to start with just actually level setting about utilization. So in 2019, Bob, there was a poll that only 4% of people over 50 had tried a telehealth visit. You fast forward that today, and now 1 in 4 older Americans have had a virtual medical visit as a result of COVID. It often takes these dramatic shifts, right, that are not done over the course of years, but literally done overnight. And to that extent, I've heard from many medical directors at senior communities saying, telehealth has been on our roadmap for 4 years. We need it tomorrow. And so there's been this drastic shift, not only from an operating perspective, but also as we think about care communities, and also just thinking about social isolation and increasing access to loved ones. Over 70% of people right now are saying they're not going to see their loved ones over the holidays. So we've seen this convergence of not only social isolation, but also isolation to actual medical care that's really caused this vast momentum to move forward. The other thing that I think is really important, Bob, is, this is all done under the convergence of, changing policy from CMS as well. So as you'll see, CMS is extending, the relaxation of many rules as it relates to telehealth. And it's no longer an option as to whether, care communities have telehealth in the toolkit. It's now the essential ingredient in order to operate a safe environment, not only for your residents, but also for your practitioners, is really, really important.
So would it be fair to say, if the perception of many in the senior living field in the first week of March was that there were incredible numbers of barriers to their being able to utilize telehealth actually inside the walls of their building, that one of the things that happened is that those barriers, those walls, most of them have come tumbling down?
Yeah, precisely. I think that's a really important point. Well, most of them have come tumbling down. One of the things that we encounter at Sitka is that many senior care communities don't have the infrastructure in place. And so now there's investments being made to equip facilities appropriately with Wi-Fi. Again, it wasn't a priority in the past because it felt like a nice to have. And now, of course, it's becoming, as essential as plumbing in your care communities.
Well, also to that point, and you alluded to that just a moment ago, I've been saying that one of the impacts of COVID was to bring the senior housing and care field into the world of digital, the 21st century world of communication. It's often said that when it comes to technology, healthcare has been a laggard from other large sectors of the economy, to which I always respond, that's right. And senior care has been a laggard behind healthcare. And, but this is broader, to your point, than just telehealth, because the world of digital, which means 5G, bandwidth, good access, Wi-Fi access, and so forth, for communication, for care delivery, and for social engagement. In all three areas, the world of digital, now we see things are possible that literally we weren't even aware of, and they didn't seem possible just 8 months ago. And that's huge. And one particular area, and then as a follow-up question, I would just comment that I think one of the biggest changes we've seen over these last 8 months, just it wasn't there in early March, and that is for older adults themselves and their adult children, the fear of traditional healthcare delivery settings, the hospital, especially the emergency department, and the doctor's office, especially the waiting room. And we've seen poll out after poll. Another one just came out last night of just showing the hesitancy and the fear of those settings. So that creates, it seems to me, an enormous opportunity for the senior living provider, because before, healthcare was something our main contribution in many times was our van, was our bus to transport to the doctor's office. And if it was the middle of the night, it was the paramedics and the ambulance. And whereas now, with that fear, many seniors having, as you pointed out, being much more likely to have had a telehealth experience, now they don't want to leave the safety of their home, and they want the healthcare service delivery to come to them where they live, because they fear having to go out or be sent out. And that's a game changer in the consumer attitude towards how they think about telehealth. So when we talk about telehealth, which I've learned so much more about from you and then over these last 8 months, but for the providers in our audience whose specialty is seniors housing and care, tell us a little bit, what does the phrase telehealth mean? Dig in a little bit in terms of, okay, I'm going to use digital, but what beyond that is really involved?
Yeah, Bob, I think that's a really great question, especially when you're trying to evaluate overnight what this new world of operating means. And in many ways, I see it as the perfect convergence for senior care communities to start extending, your offerings to include a telehealth service. You have the resident there. The resident does not want to leave. The resident's family doesn't want them to leave. And so really the concept of bringing more services in, of course, as opposed to shipping that resident out, hoping that you get them back, of course, I think that whole paradigm has drastically shifted. And so when we think about what are the telehealth options and what does it mean, telehealth is a very broad term. There's telemedicine as well that gets thrown in. And largely what we're talking about is, connecting a provider and a patient, or a provider and another provider. And so that's generally what we're thinking about. Now, the intricacies of telehealth become really interesting when you start to kind of unfold the various businesses that are out there, because a lot of people use telehealth for things like texting. And that's not necessarily the way I think about telehealth, because I think about telehealth being more of a video medium where there's more transparency and bonding and display of the encounter. But of course, a lot of, telehealth companies do start with some texting to identify symptoms and then triage them into the right queue for the right provider. So I think first it's like, do you want a texting service or do you want a video service? Do you want that service to come with a provider on the other end? And do you want it to be simply a messaging service back and forth, which we refer to as asynchronous? Or do you want it to be synchronous? Bob, you and I are on a synchronous chat today, right? We are absolutely, this was a scheduled conversation, right? We are both here intentionally today. So many inefficiencies, of course, in healthcare are burdened by the scheduling game, blind scheduling, right? Without proper triage.
Well, give an example of that as it relates to the common problem of the fall that happens at 2 a.m. in the morning, when you don't have, maybe that community may have a medical director, but it's 2 a.m. They may have a nurse who may or may not be on again at 2 a.m. Give a practical example, a little bit of, just flesh that out in terms of how telehealth can make a difference in something that happens during that overnight shift.
Yeah, Bob, I'm glad that you asked. I think it is really important to kind of like bring these higher concepts into reality, into a specific use case. So yeah, let's say you have a resident that's 87 years old or 90 that falls, and your clinical staff isn't available right away. Maybe you have a care aide that care aide could actually, get a doctor on the line and describe what happened, describe the symptoms, describe what they're seeing. And then that doctor could then identify if that patient needs to be transferred out, what needs to be done, or if that patient is actually safe there and can wait for a specialty consult, also a telehealth consult, in the next 6 to 12 hours. And so that's a perfect example of, you can upskill that, care provider just in time by affixing their brain with a specialty brain and displaying, what the care situation is. I think that's an ideal use case where, there are certain emergencies, right, where it's obvious that the patient does, or the resident rather, does need to move out and actually become a patient. However, there are ample examples where that resident can actually be safely maintained there in their community, and not only have a primary care provider overlooking the situation, but also access to a specialty provider. And then you start to create a virtual care team, and that's where you really then completely alleviate the need for that patient, or that resident rather, to go schlepping around, right, to all of these scary waiting rooms and exposing them in a really unnecessary way.
and oftentimes also having to either be hand carrying all their forms with them. For family members, is there an advance directive? Who even knows about it and can locate it? Where's this patient's history? What meds are they on? All of those things that today have so often led to confusion and, quite frankly, poor care or too much care, and so forth. Well,
yeah, I think you bring up a really good point, which is family inclusion, right? And when that patient does, or when the resident, when the resident does become a patient and goes to a hospital or to a
we're teaching you about the senior housing and care setting, Kelsey, but you continually reveal that you also do come out of a healthcare background.
Yeah,
so anyway.
And I'm so appreciative of the teachings, but I think your point is really important about how do we include the family in these really, intense care settings. And of course, telehealth is an avenue to do that, especially if it's a video messaging back and forth, or they're able to join the virtual visit. That is a way where a family member who may be 5 miles away or maybe thousands of miles away can get really great insight into what's happening with their mom or dad. And of course, then you as the senior care community, of course, creates better value for that adult child as it relates to your residents.
Well, let's zero in. Let me ask you to sort of respond to this question. I'm listening to this as a senior living provider. I've sort of seen the reality of what's been going on in my communities. Let's say assisted living, or a community that's assisted living and memory care, maybe also some independent living. And I'm thinking, well, maybe this is something I need to be thinking about. And maybe it's sooner rather than later, whereas before it was always on the later side. And I was struggling with more immediate issues as a provider, such as occupancy and, keeping my residents longer and so forth. What advice would you give to a provider that says, okay, I now think this needs to be on my sooner rather than later list, but how do I hear so much terminology thrown around, A, and B, I'm in the midst of a crisis with COVID. And it's a full-on crisis and that's become a marathon, and I'm trying to deal with staff fatigue as well as just keeping my staff and my residents safe. How can I explore this without sort of opening myself up to 100 different vendors besieging me because it's out there that somehow or another I'm thinking about how do I include telehealth in basically in my on my property and in my business model? What advice would you give to that provider who hasn't paid a lot of attention to this before, didn't think it was timely, didn't think it was necessary, now is beginning to think maybe it really is necessary? But how do I engage when I got so much else going on and I'm still in a full-on crisis?
Yeah, I think it's a really good question, and certainly an overwhelming one. The way that we start to look at this is, what resources have you as a operator aggregated in already, and how can we leverage those, right? And so doing a quick assessment of, do you have clinical capabilities right now? Do your residents want clinical capabilities? Is that something that there's a fee structure, appropriately designed for? And then starting to refine what type of care you're seeking. And, actually, Robin from Doctor on Demand and I just are releasing a bit of more of an educational piece around, what are the various aspects of telehealth that you need to consider? Do you need a physician on the other line? Is this a peer-to-peer consult from one of your physicians? What is the response time? Do you want it to be synchronous, right, which is always available in this in having a conversation, or is a messaging capability more appropriate? I think one of the most important points is, what level of acuity can your resident and your community actually safely see, and adhering, of course, to all of the guidelines and rules associated with that. But so I think there's kind of three core things, right? What is your financial structure and capabilities? What are your current resources clinically? And then how acute of care do you want to actually be prescribing via telehealth inside your communities?
good points that relate to one of the comments / questions that have come in to our viewers, because one of them points out that it's important, Dr. Stephen Fuller, that it's important to carefully assess the level of acuity that's really appropriate to be addressed and taken care of within your building. And so I think your point of sort of assessing your clinical capabilities, not that you just sort of dump a telehealth capability into a building and presto, you're going to provide all this great healthcare no matter what the acuity level of your resident. So I think you just touched on that, but I think Steve makes a really good point there. Let me ask also about, because we have another question from which has to do with, can this be applicable to one of the challenges that many providers face, which is from a public point of view, providers are being judged not only on the health of their residents, but also the health of their staff. And I would argue there's been more focus on the health, meaning are they asymptomatic, for instance, carriers of the COVID virus, but also now their mental health. 8 months in a constant crisis and the toll that that's had on staff and so forth. So are there ways, have you seen any examples of, for instance, how providers might use telehealth to also benefit their staff, who are, quite frankly, particularly their frontline staff, they're the keys to anything they're going to be doing in protecting the residents?
Yeah, Bob, I think it's one that's a really important point to make, and certainly a point of deep appreciation for all of our frontline staff, clinical, non-clinical, that are facing this every single day. And how do we keep them safe and keep them motivated and actually upskill them? And we think about this more from like, how do you upskill them just in time? So how are you not overwhelming them with information that's unnecessary, but really focused information about that resident that's sitting in front of them and how they can actually, increase the care that they're able to provide to that individual. So I do think it does become a benefit when you can actually create a toolkit for your frontline employees where you're empowering them. And ultimately, if you think about it, you're also decreasing, their level of exposure by having fewer providers schlepping in and out of your facility, your residents and communities, which of course is really essential. So how do you really empower your frontline folks and give them the information they need without making it a hassle to get? And I think many telehealth providers have done a really stellar job of actually creating those workflows so that it is helpful and not yet another thing that must be done to care for your residents.
Well, you raise a really good point, and since I've seen a draft of the longer paper that you and Robin and Carolyn from your team at Sitka have worked on, you go into some detail there, kind of what I'd say, again, it's part of the assessment of what are you trying to accomplish, and also what's the fit with your culture. Because you and I, who have had many dialogues about technology in senior living, we know that one of the great dangers is that senior management listens to something like this show right now, or goes to a conference and gets sold on this new technology, and then kind of announces it'll now be driven through the company, and particularly in terms of the frontline staff. And the frontline staff says, "Okay, I'm already working, I'm already cramming 10 hours worth of work into an 8-hour day. And now on top of that, and did you check with me as to how this would help?" So you talk about change management. You talk about sort of assessing what you're trying to accomplish with telehealth. Could you share with us, we don't have a lot of time left, but just share a couple of thoughts around that? Because again, a couple of our viewers have pointed out that, we don't want to make this too simple and in that sense simplistic, that telehealth is this magic cure-all.
Yeah, I think it's a really good point that, workflow management for our providers, regardless of, skill of providing care, is certainly an essential consideration in this, as well as, how are you designing the workflow so that it's not considered, quote, change, but it's actually an added benefit. And I think, at a high level, and I want to be considerate of our time here today, but Those are really key pieces to including, frontline staff and the considerations of the telehealth solutions that are selected. Again, so that you're not duplicating any resources that you've already worked so hard to accrue, but you're actually extending the capabilities inside your communities, of course, in a safe manner and adhering to, all of the staffing ratios, as I saw a note about in our sidebar there.
Yeah. Well, thanks. I think that's really helpful. This longer paper that Kelsey's referred to, that she and Robin Glass with Doctor on Demand and Carolyn Ryan from Sitka have worked on, is going to be made available. And again, how can people get access to that, Kelsey, if they want that? Longer
so it'll be posted, I believe, on the NIC website as well as the Nexus Insight website, and we'll be distributing that on the social media from our company at Sitka, which is trustsitka.com.
Great. Well, thank you. I see our host is back here live, which tells me we are reaching the end of our half hour, that the half hour hourglass has drained down. So, Steve, I want to thank you for this opportunity. Kelsey, terrific as always. And this is obviously, I would argue that this is the sort of thing in 6 months, Steve, we should come back and revisit what's happened. What's now the use case 6 months later?
Yeah, I agree. The nice thing about doing leadership TV the way we're doing it is we don't exactly have this hard and fast. Otherwise, we'd be blown up off the air by the next show. So I appreciate the conversation. I actually have two things that occurred to me as I was listening to the conversation that I'd like to get a little bit of feedback on. The first is that Stephen Fuller said, there's been all this talk about telemedicine, but I'm not actually hearing the physicians on these panels. And I think that's actually a good point. And so that becomes maybe more a task for me than anything else, is to actually talk to some physicians and get some physicians who are on the other end of the internet. And Kelsey, you could probably help us with that to ask them what they're seeing, what it's like. I think that's a really fascinating conversation. But the other thing that occurred to me is it seems like somebody needs to create a how-to guide. So I suspect what's happening in most buildings is they have gone to a HIPAA-compliant version of Zoom for their residents, for their existing physician that they were seeing before. But that probably means that it's not really being as optimized as it could be. And so I don't know, maybe that's something we need to take on. Somebody else needs to take on. Cheryl, maybe that could take on, to create a guidebook that operators a playbook that operators could use. So,
well, Steve, to that point, I do think that the longer paper that Kelsey and Robin Glass have done it's a start. It's not a full how-to guide by any means, but it does raise a number of considerations and cautions and the beginnings of a checklist, which if you don't address those points, you're going to, as so often happens with adopting new technology, it's actually going to have the opposite effect of what you're seeking to achieve. And I think some of our viewers have raised some of those same points. And so I totally concur with you. I think it's a great challenge to some of us in terms of that how-to guide. But I do think that's a start with this paper that Kelsey and Robin have done.
Yeah, and Steve, we would love to come back and work, with our primary care providers and our specialty providers who work with, Medicare and Medicare Advantage populations, and provide some insight there. Thanks for your suggestion, Dr. Steve.
Perfect. That would be terrific. So one last question for each of you. You look to the future of senior living, optimistic, pessimistic, or confused? And let's start with you, Kelsey. I'm going to start with you, and then we'll go to Bob.
I was hoping I could just follow Bob's lead, but okay. I'm really optimistic. I think, we've seen the senior care community continue to transform and rise to the occasion of not only the increased population that we're needing to take care of, but also now doing that in a global pandemic. And I think the headlines have been relatively favorable in many, many situations for how responsive the senior care community is about the precautions and the level of seriousness that folks are taking across the board. And I know it's no small task, and really respect the work that's being done there. So I'm very optimistic that we'll continue to evolve with the industry as well.
I'm optimistic as well, but the way I often put it is I'm bullish on the opportunities in our space.
Mm-hmm.
I'm bearish on the ability of a number of companies to adapt and change in the way that their customers changing. And because their customers changing, because the setting is changing, many companies won't survive. They simply aren't going to pivot. But for those that do, the opportunities are enormous. I teach a lot at different universities, and one of the things I like to say is this setting is an entrepreneur's dream. You have enormous demand coming. For instance, the collapse of the family caregiver model, not collapse, that's too strong, but there's so few, going to be so many fewer family caregivers available as there are more and more seniors living longer and needing care. But tomorrow's customer is rejecting today's product.
Yeah.
Well, demand, huge, future demand. Embrace of today's product, not so good. That's an entrepreneur's dream. And that's why I'm so excited to engage through Nexus Insights with folks like Kelsey and many of her peers who are going to be, to my mind, developing and shaping the product for the next 20 to 30 years, because today's product is not what the boomers are going to want.
Perfect. Thank you very much. Richard, thank you very much for helping to support this. This has been a fascinating conversation that clearly means we need more conversation. Thank you for all of those who are watching. Yeah. And I know there are always a number of people who are not able to live. And so for those of you who will be watching it through the week, thank you for supporting this.
And the paper, because the answer to the question is, the longer paper is called Telehealth is Here to Stay, Everything You Need to Know. Telehealth is Here to Stay. So that's the title of the paper that some of you have asked about. Thanks, Steve.
Perfect. And we'll get that. When you have it, when you release it, we'll grab the link and put it into this broadcast as well. So again, thank you much. Have a great weekend. Talk to you soon.
Yes.
Thank you.
Thank
Good
you.
weekend, everyone.
Thank
Bye.
you.